Good afternoon, everyone. I would like to formally welcome you to Nrmn Career Development webinar. Today, we will be discussing biomedical graduate education and careers for scientists at the PhD level. Thank you very much for attending. Today, we have our prestigious presenters, Dave Wessinger, who is at the University of Arkansas for Medical Scientists in Little Rock, Arkansas. And we have Audra Van Wart, who is located at the Virginia Tech Carilion Research Institute located in Roanoke, Virginia. Thank you very much for being here today, and welcome.
Welcome to our Career Development webinar about getting your PhD. The webinar is presented by the National Research Mentoring Network and the Association of American Medical Colleges. Our discussion today will focus on the PhD degree and or the MD PhD degree, but we will not be focused on getting into medical school or the MD degree. However, many of the same principles apply. So Audra, this is your part of is graduate school right for you?
All right, great. So we're ready for the next slide. All right, so how do you know if graduate school is the right choice for you? Well, here's a couple of questions for you. Are you fascinated by human biology and disease? Are you curious about how and why things work the way they do? And are you creative in the way you think and do things? If these apply to you, then you might be on the right track. So next, do you have an aptitude for science? Is it something that you feel that you are good at and it's been a strength of yours? And importantly, are you persistent? So do you have the persistence to see a project from its tiny beginnings all the way through to a great discovery? If so, I think this could be a good career path for you. So maybe you're starting to think like a scientist. So what a biomedical scientist is, it's an individual who uses the power of research to understand and cure human disease. And not just cure disease, but also to promote human health. So basic biomedical research involves finding out how cells and organisms work. So this is in both the healthy state as well as in the disease state. It's mostly done in the lab, but it's not always done in the lab. So there's a lot of systems level and populations level research that's done at a computer or with a collaborative group out in some kind of a healthcare setting. Certainly clinical studies are going to take place very frequently out in the clinic. So it can be hard work, but it can also be a lot of fun. So who can do biomedical research? Well, this is really for anyone with a STEM education. So this is science, technology, engineering, and math. So there are a variety of different majors that are out there, but generally speaking, some examples of STEM backgrounds are those that include coursework in the biological sciences, chemistry, physics, engineering or bioengineering, computer science, math, psychology. So again, you're not limited to these types of majors, but this is the kind of training that that many students who end up going on to their PhD in the biomedical sciences will have. So how do you find out more about research? Well, the best thing you can do is explore science. So this is the best way to find out if you like doing it, which is going out and getting a research experience. And for undergraduates in particular, there's some really great summer undergraduate research programs out there. If you do a little bit of digging, some of these are formal programs that will provide housing and a summer stipend and have usually a very competitive application process. But there are also informal arrangements. So if you read a paper or hear a news story by an investigator that's published something really exciting, go ahead and reach out to them. 3 out of 4 may not have space or may not respond at all, but don't get disheartened. If you are persistent, you'll probably find some sort of research opportunity. And this can be at your own undergraduate research institution or someplace beyond your institution. It just depends what kind of experience you're looking for. Another thing you can do is meet people who are already involved in research. So this includes students as well as postdoctoral fellows. So these are individuals who have their PhD and are pursuing more independent research in an academic or industry setting in order to develop independence and go on to run their own research teams. So they often are well positioned to give you a lot of good advice about what to look for in graduate school. You should also talk to the leaders of laboratories because they'll also have some good feedback for you.
So how can you get more involved in research as a future career? What you really need to consider is getting a PhD. This PhD can be in any number of areas of science. So all these areas shown here on this graphic are possible examples, from the physical sciences to the basic biological sciences, the quantitative sciences, and so on. All these areas of science are interrelated, and they all have a common goal, which is to improve human health. So there are many reasons to get your PhD, and one of the most obvious ones is so that you can become recognized as an expert in your field. And trust me, by the time you've spent 3 to 5 years studying your particular research project in depth, you will be among the very small group of people who know a whole lot about one particular subject. You will very likely be the #1 expert on your campus, perhaps in your state or country, or even the whole world. Just imagine. There's a lot of fun things about getting your PhD. You'll be working with your colleagues, other students, and learning from them. You'll be working with some outstanding faculty and sampling their ideas. You'll be learning about the worldwide body of knowledge in your field and taking courses, perhaps finally, that are relevant, interesting, and exciting to you. Hopefully you'll find a mentor who's thoughtful and caring, and one who will launch your career and be a lifelong colleague and friend. Most importantly, your degree as a Doctor of Philosophy will give you the tools you need to do or direct creative and significant research. In biomedical science, the PhD degree is really a degree that says you know how to do research. That means you know how to identify that critical knowledge is missing, what critical knowledge is missing and needed to solve a problem. You know how to state the question as a hypothesis, and importantly, you know how to set about answering the question through the design and conduct of appropriate experiments. This skill set will provide you with a wealth of career options. As we go along, some of you may have questions, and you can start typing in your questions now, and we'll be answering your questions in a panel discussion at the end of this webinar. There are many training opportunities available for biomedical scientists, among many university programs associated with graduate schools in the arts and sciences. But the vast majority of these training locations are associated with the 130 or so medical schools in the United States where significant biomedical research is being conducted. There are a few other places, such as the NIH, which partners with graduate schools to provide training opportunities through its intramural programs and through the Graduate Partnership Program, and even a few others beyond that. A key trait that PhD training programs have are seeking trainees that have the aptitude, desire, and ability to conduct research. However, before they turn you loose in a research laboratory, they will usually want you to have basic communication skills and basic science knowledge. So the ability to do well in coursework is also important. The #1 predictor of someone who will have a successful career in research is an early and sustained interest and participation in conducting research. But all's not lost if you do not have this particular credential. Say you just have a good understanding of good to outstanding grades, and you have good GREs and letters of recommendation. You still might have a good chance of getting into a great graduate program. After all, learning how to do research is why you want to go to graduate school, right? But a solid grounding in research experience, more than anything else, will help you prepare for and get into graduate school. It's very important to gain research experience so that you know what you're getting into. You'll need to be familiar with the concepts of hypotheses and hypothesis testing. You'll need to understand what the implications of your research are, and you should be able to answer the question, why is this research important? And you will need to develop your communication skills so that you can describe your research experiences and especially your contribution to the project. So during the first year, shown on the left side of the arrow there, during the first year or two, you'll likely be taking coursework and building a broad basis of knowledge that will help you understand science and communicate with others. And you'll likely spend time outside of the classroom doing rotations. You'll sort of be a visiting scientist in someone's laboratory, learning about that laboratory's research interests and acquiring new lab skills and techniques. In addition, you'll be making contacts and networking with students, postdocs, and faculty. Ultimately, these rotations will lead to you to select a mentor and a research project. Most programs require that you pass a milestone before allowing you to begin your actual dissertation research. This is called the qualifying exam or candidacy exam. These can take a variety of forms in different programs, ranging from a comprehensive exam of all your coursework to more focused exams that focus in on what your particular proposed dissertation research will be. Once you pass this milestone, you're officially a candidate for the PhD, and you're officially ready to embark on your dissertation research. During the next couple of years, years 3 through 5, you'll be spending time doing your actual dissertation research, and ultimately, you will write your dissertation or thesis and defend it to your research advisors and usually the campus as a whole. And along the way, you'll have many opportunities to write about your research for publication and to present your research in local, regional, national, and perhaps even international scientific meetings. So in earning your PhD, you will learn how to ask important questions and how to find answers. It's likely you'll encounter some difficulties along the way. No one cuts new pathways without running into some roadblocks, but you'll learn to overcome obstacles. You'll learn to chart your way through uncertainty. Uncertainty is not really an obstacle, it's an opportunity. By learning to think like a scientist, you'll be able to be at the forefront of creating new information. Through collaboration, you'll learn how to prevail and become more competitive. And you'll be qualified for many career opportunities, careers in scientific industries, academic science, teaching, editing, leadership. There are really endless opportunities when you have the ability to acquire new knowledge and use it to your advantage.
All right, so I'm going to now talk a little bit about what you do with the PhD. So I really want to highlight, following up on some of the things that Dave just talked about, when you're pursuing that PhD degree, you are becoming not only an expert in that field and not only technically proficient, but you're developing many other transferable skills that make you a PhD level scientist, that make you somebody that employers are going to expect to lead teams, either in research or in research support positions. So you've developed a number of transferable skills by the time you graduate, and these include teamwork, leadership, the ability to communicate science and convince other people, especially people with funds that you'll most likely need to obtain, convince them that what you're doing is important. You'll learn time management and you'll learn multitasking. So these are useful for a variety of different career options. Now, back when I was a graduate student, if you did anything other than academic research, those were considered alternative careers. And now it's commonly recognized that these are not alternative careers, but there are a variety of careers that PhD level scientists can pursue, and these individuals are critical individuals that are contributing towards the biomedical workforce. So what I'm displaying for you here is the results of a study that was done by the National Institutes of Health, where they looked over the course of a number of years at where US-trained biomedical PhDs were employed. Now, if you look at the green and the purple pieces of pie, you can see that, that roughly half of the US-trained biomedical PhDs went into some sort of academic role. So these include tenure and tenure track academic or research or teaching positions, as well as non-tenured and non-tenure track academic positions. But many individuals also went into industry research, government, science-related non-research positions, which I'll talk to you a little bit about what these might be, as well as non-science related. And I would also like to highlight that there is a very tiny wedge that represents unemployment. So, so this is a good degree to pursue if you want to be employed, and it's really a matter of figuring out where you want to be employed. So let's look at these wedges in a little bit more detail. So there are a variety of career possibilities for you with a PhD, and I didn't want to be overwhelming and list them all, but here are some general categories. So one category is large research institutes like the National Institutes of Health, as well as academic institutions. So, so within these large research institutes, these also include other government agencies like the Department of Defense and the Food and Drug Administration, state and county health departments. And there's room for individuals who are going to be leading research, as well as for more supportive roles. And these supportive roles could include things like program officers that manage grant portfolios and peer review. Another job sector is what we can loosely refer to as industry. And this is where pharmaceutical companies and biotechnology companies lie. And that's probably most commonly what people think of when they hear about industry positions. But there are also jobs at medical device companies. Entrepreneurship is another option where there's an increasing amount of funding going towards, so starting up your own company based on something that you've discovered in the lab is an exciting opportunity. And then within industry, again, there are also non-research roles, such as in regulatory, in business, such as forming strategic partnerships. There are jobs called medical science liaisons that communicate information on behalf of the company to scientific audiences. And then there's also the entire area of intellectual property and patents. So there are people that are employed in this capacity, both in industry as well as in academia and in government, such as the U.S. Patent and Trademark Office. So there's a lot of opportunity around this area. And before I move on from education, I just want to mention that academia is also a very diverse employment sector. So within this field of education, you can potentially be employed at a medical school or at, as university faculty at a large academic institution. You could be an undergraduate college professor at a small liberal arts college. Many individuals are also employed at hospitals. And some PhDs even go on to instruct in high school or in middle school. So it's really a matter of the audience that you want to reach with your degree. And again, there are opportunities for research, there are teaching positions, and there are also administrative positions. And something to keep in mind is that many positions don't focus on just one of these areas. So you may be a researcher that has a lot of administrative duties, and actually one might argue it's impossible to escape administrative duties. So there are a lot of opportunities within academia itself. And then there are also areas like science policy. So this is a critical role that is becoming, the importance of this role is becoming recognized, especially in recent times. So we need advocates on behalf of the scientific community, people that can communicate the importance of science, both to our elected officials as well as to the citizens of the country as a whole. I'd also group into this category philanthropic and nonprofit organizations. So these might include the National Academies of Science, scientific societies and associations, for example, the Society for Neuroscience, as well as private foundations. They all have a need for PhD level scientists to be involved in policy, to be involved in communication, as well as managing grant portfolios. And then the last category I was going to mention is scientific communications. So this is also a broad category. So there are PhDs that go on to be reporters in the broadcast media, such as National Public Radio. They write for newspapers and magazines. They also serve as scientific editors for scientific journals and for textbooks. And this is really an area where where the PhD is critical for fulfilling that role. So does that sound overwhelming? There's a lot of opportunity that's out there. Next slide. So now that we've thrown all this out there, you're probably thinking, I don't know, this all sounds tempting, but what if I'm still not sure if this is the right path for me? Well, it's important to know that there are many paths to graduate school. There's not one path that's right for everybody. You really have to look at your own background, your own experiences, and how much soul searching you still have left to do before you figure out what you want to do. The PhD, it's a long haul, and you want to make sure that it's something that you're really excited about doing, because you're going to have struggles along the way and times where you're going to want to quit. And research is called research because you research. This happens over and over again, and you're going to have to push through. So you really want to make sure that it's something that you have a passion for. So if you don't want to go into the PhD directly from the bachelor's, there are a number of additional routes. So you could participate in a Postback program. So the National Institutes of Health has a wonderful Postback program that offers opportunities for both research as well as professional development and even taking coursework. There are programs that target underrepresented students in science. So for example, PrEP is a one-year fully funded Postback program. And PrEP, many institutions have PrEP programs embedded within their institution. You could pursue additional research training. So you can go out into academia and ask a professor, you know, can I work in your lab for a year while I'm deciding whether or not to go to graduate school? Or you can go out into industry and just get on the job experience. Maybe you just need to take a few additional graduate courses in order to really narrow down the field that you're most interested in, or to develop a stronger application. So that's a possibility. And some individuals decide that they're going to go and get that master's degree first. So many institutions many biomedical PhD programs do not require that applicants have a master's, although there are exceptions to that. But perhaps this is really the path that is best for you. No matter which path you take, there are a few things that we want to emphasize before you apply. And the first thing is to read the scientific literature. So you want to get comfortable reading papers. This is something you're going to be doing a lot of. Many programs have moved away from textbooks altogether and really focus on primary research manuscripts. So you want to start to learn to speak the language of science before you enter that PhD program, and also understand how science in that area that you're interested in, how it's done. What types of experiments are you going to be doing? What are the experiments that really excite you? You're going to want to attend research conferences. So this is important both for networking and for helping you to decide what area you want to pursue. So these research conferences are really great, especially when there are a lot of students presenting posters. So just take a few minutes and peruse the posters, and you don't have to spend a lot of time at each poster, but when you see something that really excites you, talk to the student, ask them about their graduate program, their institution, how they enjoy performing those experiments, and what they think is worthwhile. So getting these firsthand experiences, to hear stories from graduate students, and to hear about the research and the types of institutions they come from, this is going to be very informative. And it's also going to offer you an opportunity to network with individuals that might be able to provide you advice in the future. And that leads into the next bullet, which is network. So networking is going to be very important, both for collecting information as well as collecting leads that might help you identify research mentors, and one day may help you identify a job opportunity. You should make the most of your mentor relationships, and this includes especially your research mentor, but also other individuals that you feel are mentors to you. So these are going to be individuals that are going to be writing you reference letters that future employers will be calling to learn more about you. So they're not just a source of information and advice, but they're also people you want to make a good impression on so that they can speak on your behalf and really help move you along in your career. So try not to burn bridges. Science is it's a small world. It's much smaller than you think. So definitely nurture those relationships. And then lastly, understand the PhD application process. So there are also a number of webinars and opportunities at conferences to hear about the application process. It's going to be different from institution to institution. So it's different than, for example, the medical school application process, where there's one streamlined application for many, many universities. The PhD application process is going to be a little bit different. And so it would be helpful for you to inform yourself on that process so that you are well prepared to get into a great school. So where can I find more information? Certainly start at the AAMC website. There is a section dedicated to PhD training. The NIH also has a wonderful website, a lot of resources, both in terms of professional development as well as career development and job opportunities. So I encourage you to visit that website as well. Reach out to directors of summer programs and mentors in summer programs and postback programs. They can serve as a good source of advice. Professors and lab heads. If your institution has a career advising office, take advantage of whatever it is they have to offer. Graduate students and postdocs are a great resource, as I had already indicated. Though if you reach out to graduate students, don't just reach out and take the word of one or two. Make sure you are getting a diverse set of opinions, because every experience is really going to be unique. And then, of course, graduate schools and PhD program directors are a great resource for learning more about those PhD programs that you might be interested in. So from great minds come great discoveries, and that's what the PhD is all about. And I think at this point, Alexis is going to mediate the question and answer session.
Yes, indeed. Thank you so much for that insightful perspective and tools to provide our users on how to initiate that application process. So, question 1, what path should you follow to have a career in patient-oriented research as opposed to basic laboratory research?
Well, so different programs are going to have different emphases. And so as you're doing your research about your graduate programs, you're going to want to research into what research opportunities are available. In other words, what types of professors are what kind of research are the different professors that are associated with the graduate program doing it? So what you're going to want to look for is a program that has more clinical type of opportunities than, say, a program that is just the basic sciences, biochemistry, physiology, pharmacology, and so on. So perhaps even an interdisciplinary program would be a good thing for you to look for if you're looking for that type of opportunity.
And you're most likely to find these opportunities, these types of graduate programs at institutions that are affiliated with medical schools and teaching hospitals.
Great, thank you very much, doctors. So we have another question. How can we explore these other career options during our training?
That's another thing to look at when you're applying to graduate programs, is you want to look at institutions that have some sort of formalized opportunity, or at least a support network for pursuing these types of opportunities. Not every institution, it's not necessarily part of the culture of every institution to have a lot of resources that will direct you towards those opportunities. So I can speak at least on behalf of Virginia Tech, where I'm located. We have what's called the BEST program, Broadening Experiences in Scientific Training, and that program itself will help support students in finding internships. There are professional development workshops and lots of career talks. So I would definitely do a little bit of digging when you find some programs that you're interested in applying to, and ask the students how informed they feel, and if they've had about the different career paths, and if they've had opportunities to be better informed on those career paths.
So seek out opportunities to speak with students that are in these graduate programs. At our school, we tend to try to put students that are exploring our program in touch with our students, because we find that our students are our best advertisers for our program, and they also can communicate the information that the students are really seeking most efficiently and effectively and enthusiastically. So we let them be our spokesman very often. So I would definitely seek out that. And of course, the internet is a great source of information for all kinds of things. So use your search engines and dig in there.
I mean, the best launching point, I think, is trying to set up some informational interviews that will get you, that will serve as a starting point. Are there certain organizations that you should be following, or are there certain, other networks that you need to be tapped into? And getting those first informational interviews is really a matter of taking advantage of people that you bump into, or your alumni network at your institution, things like that.
As far as approaching scientists that are associated with graduate programs, a lot of times students are very intimidated about the idea of doing that. But the truth of the matter is, most scientists love to talk about their stuff. And many of them are very enthusiastic about sharing their enthusiasm for science with students that are seeking that information. So you'll find that most faculty would be very interested in talking to you on an informal, informational type basis. Your problem won't be getting half an hour of their time. Your problem will be getting out of the office before an hour's passed.
All righty, thank you. So here's a great question. Should I know my career path before I proceed with my PhD?
I don't think so. I mean, that you should pursue the PhD because you love research and you want to be a leader, potentially leading research. But it's designed to train you for careers that are supporting the research enterprise. So I think that's what you should consider first and foremost. And people are going to change their mind about what they want to pursue. Sometimes people can't find careers in their first choice. I mean, tenure track positions in academia are very competitive. So I think if you enjoy the science, it's going to lead you along a path towards a career that you'd be interested in.
The old school way of doing things, which is still done at a lot of places, you did need to know what you wanted to do before you applied. So you might have to, if you wanted to do biochemistry, you'd have to go to a biochemistry department to do that. And once you were there, you're kind of stuck doing biochemistry because that's what everybody in that department does. But the more modern programs are more interdisciplinary than that, and they allow students to come in and perhaps spend half a year or even up to a year kind of exploring different avenues, and they get a little bit more chance to figure things out. So it's much easier to figure out as you go. I think the answer to your question is very much a definite no, with some exceptions. I think most programs, especially the interdisciplinary programs, actually encourage students to try things out. In our interdisciplinary program, I tell students that are coming, a lot of students come in and they are like, I'm going to do this. And I say, well, try on a few things and see what shoes fit. And very often we find out that they change their minds. They find another area that they're suddenly interested in as well. So
I think I would just also caution against being too open-minded. We have some students that they enjoy everything that they do, which is wonderful. But at some point, you have a certain number of rotations and you have to make a decision. So you should enjoy the freedom to explore in interdisciplinary programs that allow for that, or umbrella programs that let you specialize later on. But also know yourself and keep in mind that you have to make a decision and be thinking about that as you're pursuing all those opportunities.
You don't get to be a graduate student for the rest of your life. You should try to keep it down to 4 or 5 years or 6.
Okay. Here's a wonderful question. How much are the biomedical sciences moving towards technology? Emphasis on computer sciences, programming? Would learning a skill such as programming be beneficial to an upcoming graduate students in this new age?
That's a good question.
I mean, it really depends on where you're going, but
Mm-hmm.
data analysis is key, and programming is very important for a number of different disciplines. So it's not to say that you'll necessarily need to know programming, but if you knew enough that you weren't scared to explore that as a possibility, that those avenues of research, that could be beneficial for you.
Certain areas of research certainly would rely on those type of skills more heavily than others. At our institution, we've recently expanded dramatically in the area of bioinformatics. And so there's lots more opportunities for students to get training in that area at this particular institution. And I suspect that's probably true at a lot of places.
And I'd just like to add that if you could only pick one area to be strong in, I would make sure that you have try to get a solid foundation in statistics, and not just taking the class and checking the box, but really understanding it and feeling like you can apply it to your research, because rigor and reproducibility is an important issue. It's always been an important issue, but it's coming to the attention of educators in a big way because of all the errors that are out there in science. So we want to try to ensure that scientific studies are performed rigorously, and that everybody who's involved, even if you have a statistician that's part of your research team, that everybody on the team really understands the statistical approach that's being taken towards that research.
Absolutely. Okay, so is there an MD/PhD pathway program that follows the social sciences such as anthropology?
Don't know the answer to that question. I don't think we have one at our institution, but I imagine there are some. What do you have to add to that, Audra?
Well, we don't have any here. Now, if you had said the engineering sciences, I could have helped you. I'm sure that there's something like that out there. Nothing comes to mind.
Google, you'll find it.
Wonderful. Okay, so what is the benefit of getting a PhD over a master's degree or even a postback fellowship or certificate? Aside from a higher level of autonomy, can you do a lot of the same work with a master's?
You want to take that one?
Yeah, I think there's a lot of probably differing opinions on this. I always try to emphasize as a PhD, you're going to become a key opinion leader. And if you want to lead the group and you want to direct the science, then that's the degree for you. If you're not sure you want that level of responsibility in terms of leading the science, developing the ideas, finding the funding, then maybe you would be happier doing research at the master's level. I mean, a master's level scientist could have better hands-on skills than a PhD level scientist, but there's more to that PhD level training.
A PhD is more of a way of thinking and being able to self-educate yourself, giving you a lot of flexibility. Whereas so the PhD is kind of the leader of the pack, and the master's students are often the worker bees. Very important, critically important parts of the workforce, but it's not just a steady increase in the level of education that you have from as you go through those different degrees that you asked about. It's really a completely different way of thinking, being able to identify questions that need to be answered, being able to figure out how to answer the questions, and then how do you communicate those answers to the public or to where they need to go. That's the role for the PhD level scientist.
Wonderful. Okay, next question. Would my application still be competitive if I have a background with not much research related work?
So perhaps, but research helps a lot in getting to where you go. But most programs are looking at their applications in a very holistic manner, and they consider basically the whole the whole person. Research is an important component of that, but there's lots of other important components, such as, how well do other people think of you with regard to the work that you've done, your letters of recommendation, your performance on standardized tests, your performance in school. Your own level of enthusiasm can be an infectious thing that can draw people's attention to you. So I wouldn't give up on the idea. And one possible thing to consider is get more research experience. There's lots of ways to do that. One of the arrow slides that we had listed a lot of pathways to the PhD that involve getting more research experience by different means.
Yeah, I mean, I think, so I concur with everything that Dave said. I think research is probably the #1 thing that we're looking at in our graduate programs. So we need to know that you have the capacity to do research and to be successful, and we want to know that you've had enough experience that you know what you're getting yourself into, such that you're going to push through a program that could last 4 to 5 years, and possibly more, depending on the successes and failures in the lab or other research settings.
If you don't have a lot of research experience, it's probably worthwhile for you to go get that research experience before you set off on this long journey, because you want to make sure that this is what you really want to do. And there's no way to know it without trying it.
Absolutely.
And it's not just about figuring out. You might have an experience and realize, I really don't like molecular biology. Maybe I want to do electrophysiology. Do I have to keep getting one research experience after another? It's not just about the techniques or being there. It's about kind of these things that people don't really talk about, like accepting the realities of how unreliable biology is, and that there's error, and do you feel comfortable pursuing questions with so much uncertainty in biological sciences, and just the thought process, the experimental method. There's a lot to it that goes beyond just, did you like that experience versus that experience?
Yeah.
Alrighty, let's say your GPA is subpar, around a 3.1. Would you have but you do have an extensive research experience and a great GRE score. Would applying to a PhD program be best, or should a master's be the first step?
I get that question a lot, and there's a lot of students in that exact same category. There's several different answers. If you have truly a large research experience portfolio, and you have the good GREs, it might not hurt to apply, but you might want to think about having a plan B in your back pocket. Now, most of the biomedical sciences don't necessarily go through the master's as a step towards a PhD. A lot of graduate students in the biomedical sciences go directly to the PhD, but certainly going through a master's as an interim step would get you a long way there. And a lot of times the master's training is essentially the same as the coursework training for the PhD. So if you did get a master's, you could essentially perhaps count your coursework as being largely completed. And when you get accepted into a PhD program, then you would be more ready to move directly into the research phase. Another thing to do is just go to the place where you think you want to go to school and take a couple of courses. Most places will let you take a course even though you're not in a program. And that's a good way to do it, especially if you nail it and get an A in that course and get the attention of some of the professors who would be interested in perhaps having you in their laboratories as a PhD student. You can prove yourself that way, get some good grades, and can help grease the skids for you for getting into graduate school, even though you might not have really high GPA.
That's all good advice. And I just want to add that we do also look at the trajectory of the grades. So if you had, maybe 1 or 2 bad semesters when you first started out as undergraduate, but then you really, got yourself together and performed very well during the later semesters, that also influences how we look at and interpret the GPA.
Yeah, that's definitely true. And some students have a story about, why their grades are bad. They run into some tragedy during their undergraduate years. And so if you have an explanation for why you had a couple bad semesters, I'd certainly make that part of my application. It'd have to be a truthful explanation, but certainly there's room for consideration of students that don't have the whole portfolio nailed, but have a good portion of it in good shape. Like I said, most people these days do a pretty holistic review and consider, if you have a weakness in one area and a really strong strength in another, those kind of wash out. So.
And if there are special considerations like that, like a life event that you do plan on putting in your personal statement, I think it can also be helpful if one of your reference letter writers, if they happen to be aware of that situation, if they could also just touch on that briefly in their letter, just recognizing that and acknowledging whatever that situation was.
Absolutely. Alrighty, thank you. So we have a couple of questions surrounding this topic. Alrighty, so what type of opportunities would an MD/PhD be open that would not be available to just one of those degrees? Where is one degree more favorable than the other in medical research?
Well, there's not. There are many examples of faculty or scientists that have a MD, PhD degree and are successful research science, physician scientists, but there are as many examples of a person with just an MD degree who has a successful research career. Some people are maybe born with the ability to do PhD type research without having even gotten a PhD. And some people maybe need some specialized training in that area. So the MD PhD, it trains you how to think like a scientist, but in addition, you have the ability to interact with patients and understand the needs of biomedical science from the standpoint of a physician. So I think that's a big advantage over just having one degree or another. A PhD really doesn't have very many opportunities to get their hands on patients. And so that is kind of a limitation there. So the MD PhD brings that additional perspective front and center.
If you're interested in clinical research, that would definitely have to be, you'd have to collaborate with a physician if you only had the PhD. The MD has the advantage they can recruit patients into clinical trials. They may have better access to tissue samples. It really depends on the type of research you're interested in, but definitely that patient-centered research, if you're interested in that, you may want to do the MD or MD PhD.
Wonderful. So do you have any practical advice in regards to paying for a PhD program?
Well, if you go to a good school, a good program, you shouldn't have to pay. So most graduate training programs for the PhD in biomedical sciences will provide a stipend for you to live off of, as well as a tuition waiver, and usually contribute part or all towards some health insurance package.
A lot of variation about what packages are, but for the most part, in the biomedical sciences, you can usually find a program that will give you almost complete support.
Wonderful. So what range of GRE score do you think would make your application attractive?
Perfect. I mean, I cannot lie. If you have very high GRE scores, they're gonna stand out. It's automatically gonna stand out, and they're, you know, graduate schools across the country are trying to really promote admissions committees using a holistic approach, and I think many of them do. But there are always individuals on committees that have that bias towards a number, and when you score in the 95th percentile, that is going to, that may weigh heavily for some people. I would just say do your best. If you take it twice, you know, and do your best. That's there's nothing more you can do. I would not recommend taking the GREs, you know, 8 times to try to keep improving your score.
So again, I agree with what Audra says, and I think different programs consider the GRE portion differently, just as different individuals weight the GRE portion differently. I myself don't give it a lot of weight as long as it's kind of in the middle range, or middle to above range. But there are people out there who think that's the main ticket to identifying good candidates. My personal experience is not that is not the case, but there's a lot of variation in how much people rely on the GRE score. So, you know, your best bet is to apply to several places. You know, if you have a marginal GRE score, you might find a place that's doesn't weigh the GRE quite as heavily as other places. So.
Another piece of advice, if you feel like you haven't performed strongly on one part of the GRE, I would certainly try to emphasize in other parts of the application that you have strength in that area. So if your verbal GRE is low, you may want to emphasize other opportunities you've had to write independently or communicate your science, just to indicate, you know, that you just had a low GRE score, but you are still a great communicator, for example.
Indeed. So what advice do you have for a person who wants to get their PhD, but they applied and got rejected to graduate school? How can they make themselves a better candidate?
Well, it kind of goes back to the earlier question we had. You know, get some more research experience, take some graduate courses, improve yourself there, and try again. Get to know, you know, do some networking. If you're taking courses out of graduate school, get to know some of the professors, volunteer to work in their laboratory, perhaps even get a job working in their laboratory, get paid to do it. Let them get to know you, and perhaps the tide will change.
I think it also helps to find, if you have a mentor that you can go to and say, this was my application package, I didn't get into any of the schools. I mean, it's one thing if your application doesn't get you interviews, and then it's another thing if your interviews don't get you positions. And there could be many areas that you might need to improve in, but having someone who will be honest with you and help coach you might prepare you for a round 2, or
Very good advice.
Yeah.
Yes, and somebody submitted this comment anonymously, but it's a really great one. So I would like to bring attention to the problem with saying that some people are inherently better at research. There's a difference in opportunities between people that gives certain people advantages over others. Just wanted to put that out there so people don't feel that they are somehow not cut out for PhD programs. Awesome.
Okay.
So, next question. What is an example of a career path you have heard of where a person with a PhD works in a non-research job and is successful?
Lots of them. So I've had 3 graduate students, and all 3 of them are working in non-research positions, and they're all 3 very successful. So, and I'm sure Audra, working with your best group, has many more examples of the same.
Yeah, I mean, it also depends on what you define as successful, but I mean, we have speakers coming here regularly. You know, some of them are my old colleagues that are now either senior producers at NPR, leading journal portfolios at Nature Publishing Group. I have classmates that have gone on and become intellectual property lawyers working for major law firms. So it really depends on how you define success. But if you are talented and you demonstrate that you can handle responsibilities and apply the science beyond the bench, then there are opportunities for you. Hopefully that answers the question.
Indeed.
What's that?
I said, hopefully that answers the question.
Yes.
And I think if there are people that with their PhD, I mean, your alumni network and your development office probably have access to individuals who have been successful, especially if they're making donations to the university. I'd say they're probably in a successful position. So, I mean, maybe reach out to those alumni and see what they have done and look at their career path.
Great. Well, it looks like that is the conclusion of our question Q&A section. Thank you very much, Dr. Wessinger and Dr. Van Wart, for taking the time to participate in this very insightful webinar. Greatly appreciate you. And would also like to take the opportunity to invite you to connect with NRMN. So this webinar will be featured on our YouTube page, as well as on our nrmn.net. So please do follow us on all of our social endeavors. Also, if you have not subscribed to the Nrmn Newsletter, please do so simply by texting NRMN to 22828. We have chock full of events in there and all of our latest up-to-dates, such as this, an example is such as this wonderful career development webinar. So thank you very much again, doctors, and hope you have a wonderful day, and thank you for attending.
All right. Our pleasure.
Thanks to all the participants who stuck around.
That's right.